Wake that ass up.
Early in the morning.
The Breakfast Club.
Morning, everybody. It's DJ NV, Charlamagne the Guy. We are the Breakfast Club. We got a special guest in the building.
Dr. Joseph Puma is here.
Dr. Puma, welcome.
Thank you for inviting me.
Now,
Dr. Puma's been here before.
Yes.
But it's very important to note that February is American Heart Month.
Correct.
Yes, as well as Black History Month, of course.
That's
right.
correct.
But that's why we have him here today to talk about all things heart health.
Now, for people that don't know or didn't hear when you were here previously, tell people what you do.
I'm a cardiologist. I'm the founder of Sorin Medical, which is the largest independent cardiology practice in New York City. My goals are to democratize healthcare. We have objectively, we've won an award 4 quarters in a row for the #1 heart scan in America, the highest quality imaging. We're insurance-based. We take care of everybody that comes through our doors, whether they're a billionaire or they're undomiciled. Our goal is to be part of the communities that we work in and to try and educate and help people live longer.
I tell people all the time, man, I've dealt with real bad anxiety my whole life. So, I always have the heart palpitations. I always feel like I'm having a heart attack. So at the end of 2022, I did like every single, heart test you could imagine. But the one that put me at ease the most was the Sorin heart scan. Could you tell people what the Sorin heart scan is, Dr. Puma?
So when we image the heart, we're basically using a camera, right? The Sorin heart scan uses the fastest camera available in the world. It's a CAT scan. It's the only one of its kind in New York City dedicated to evaluating heart disease. And in a 3 to 4 minute scan, we're able to see the arteries in the heart, see if there's any blockage, to see if there's any plaque, buildup of beginning of blockage, calcification. We can see the heart chambers, the major arteries in the body, the aorta, pulmonary arteries. In addition, we get a limited view of the lungs and other structures. But it's the most accurate scan. It takes 3-4 minutes. It's eliminated the need for having stress testing. And more importantly, it's eliminated the need, and this is all peer-reviewed, published data, eliminated the need by almost half for having invasive heart catheterizations where you have to go in the hospital and we have to put catheters in. So a simple test. Charlamagne, I think you're right. You've been a big promoter of mental health. And, about half the people that come to a cardiologist have symptoms that sound like it's from their heart, but it's often just from anxiety and stress. And so often that one simple scan, if it's completely normal, like yours, DJ Envy, was perfectly normal, can put your mind at ease and allow you to get on with your life without worry.
Well, let's talk about the scan. So, every year I go get a physical, and I heard Charlamagne talk about this test that he did for his heart and how, how he felt comfortable after. So I have 6 kids, so I like to, as much as I can, try to prevent anything or try to check up on anything. So I went and got the heart scan. It didn't take that long. Like you said, maybe 10 minutes the longest I was in the office in totality. So just tell people what it consists of, and we could do a reading on mine. I'm fine with it. And so let's go there. So people come there, and now what happens when they get there?
Okay, so the first thing I think that's important to understand is, number one, heart disease is the #1 killer in America. Okay, even if you add all the cancers in the world, in America together, heart disease kills more people every year.
Wow.
And that's not to minimize, the effects of cancer. That's just to say this is a major public health problem.
Correct.
Second, I appreciate you inviting me during Heart Health Month, February, because it's also Black History Month. And for the African American community in particular, they die at twice the rate of whites from heart disease. They develop high blood pressure, diabetes, at a much earlier age, and so they're more likely to have complications. What the Sorin heart scan does is you come in the office, you can arrange it on your own, you can call pound 250, you can go on our website and schedule it at your convenience. When you come in, you get the initial paperwork, which takes a minute or two. We bring you in, we put an intravenous in, an IV in your arm, we bring you in the lab, you lay on the table for the CAT scan. Our unbelievable nurses then will monitor your heart rate and blood pressure. because we're imaging a moving object as opposed to doing a scan of your brain or your abdomen, which is not moving. We want to get your heart rate down to around 60 to 65. So they might give you some intravenous medication to lower your heart rate. They'll put a nitroglycerin under your tongue because that helps dilate the arteries around the heart so we get better pictures and we can really see the flow. And then we do the scan. And all of that, as you said, shouldn't be more than 15 minutes in the office, and the scan itself about 3 to 4 minutes.
Now you did my scan a couple of months ago, and I was very nervous. Not nervous of what is wrong, but I guess nervous about finding out, right? I think that's what most people like. Most people don't want to find out if something is wrong, right?
Shoot, I do when it comes to the heart, because tell them about that Widowmaker, Doc.
Yeah, so again, just from the standpoint of understanding heart disease better, a third of people who have heart attacks never even knew they had heart disease before they had them. A third of people who have heart attacks die the day they have their heart attack. So it's not pleasant. So some of this is silent. It grows as time goes on, right? Especially if you have risk factors, high blood pressure, diabetes, smoke, you're overweight, you're sedentary, if you have high cholesterol or a family history of heart disease. Okay, these are all the things that as time goes on, the body changes and you're building up plaque and blockage in the arteries. But once you have the test, even if you have a severe blockage, we can easily treat it. 9 out of 10 times, if a blockage is severe, the flow is limited through the artery, and we have some objective data, objective approaches to figuring that out. 9 out of 10 times, we can treat it with a stent, which is an outpatient procedure. Unfortunately, 1 in 10 times, you might need open heart surgery.
Yikes.
But it's proven you'll live longer. And even in the people who say they don't have any symptoms, oftentimes after we've treated their arteries and their heart, they come back to the office and follow up and say, you know what, I actually feel better. I didn't think I felt bad, but now I feel better. So I understand there's a lot of stress and anxiety about it. The other thing is, if the scan is completely normal, no plaque, no calcification, no blockage, let's say like your scan, that means over the next 10 years, your risk of having a heart attack, stroke, or death is less than 2%.
Jesus.
That
Amen.
is the best. That is the best risk group you could be in. But we're able, even if there is mild or moderate plaque, we're able.
Like me.
Right. We talked about your risk factors. We talked about the goals of cholesterol treatment or blood pressure treatment. And once we know that, your survival should be exactly the same or pretty close to DJ Envy's, your lifespan. And in fact, we calculated a risk, and it was like 2.5% over the next 10 years, a risk of heart attack, stroke, or death. So the key is just show up. You never know what you find. One of the most amazing experiences I had last year, Charlamagne, was when we attended your mental wealth expo.
Thank you for coming through.
Oh, thanks for inviting us. I mean, it was inspirational to us. There were thousands of people there. Many of them were there because of mental health issues. But the reality is, many of them were there just because they were trying to take charge of their health. They were searching for information. They were, and you're someone. The two of you are people that that have influence. People listen to you, okay, and they trust you. And so we set up a booth, and we were doing free blood pressure screenings. We must have screened 400 people that day.
Wow.
Over 200 of them, their blood pressure was out of control. And out of that 200, about 50 or 60 didn't even know they had high blood pressure. So just show up. It's simple things. As a community, as physicians, we can do screenings, for instance, in the local churches, barbershops, anywhere really, schools. And once you have that information, DJ Envy, then it's just a matter of finding a doctor or a healthcare provider that you have faith in, that you trust, and working with them to get on the right medicines and monitor and control your blood pressure or your cholesterol or your diabetes.
Yeah, I'm on statin for my cholesterol, but you keep mentioning high blood pressure, you keep mentioning diabetes, you keep mentioning stroke. what I find interesting is that young black people are living with diseases more common at older ages. They're living with these diseases that are usually more common at older ages. That's scary.
That's exactly right. In the black community, compared to the white community, if the rate of high blood pressure in blacks between 35 and 49 is 50% higher than whites. The rate of diabetes is 40% higher. And if you have these chronic diseases earlier, they're more likely over time to cause complications, to have problems, to cause heart attack and stroke. And even at 65, heart disease is blacks are 50% more likely to die of heart disease than whites. So these are chronic problems that can cause devastating acute complications. And so finding it early and treating it and following with the doctor. From a physician standpoint, it's our job to make it easy. It's our job to listen. It's our job to build a relationship. It's our job to make sure when you have a test, for instance, you get the results of the test. And we explain to you, clearly in language you can understand what the implications are and how best to treat it.
I was going to ask if you just, go over some of the stuff. So what are you looking for when you're actually doing the scan of the heart? Now, is it easy to detect plaque? And where somebody does have plaque or somebody does have a problem, you can actually fix the problem right then and there, correct? In most cases?
In most cases, in New York State, we still have to bring you to the hospital to do it. Although, as you reflect, we have an ambulatory surgical center in Lower Manhattan, and we can fix lots of problems there, but we're not allowed to go into the heart yet. So we still have to do it in the hospital. But if we see a widowmaker lesion, we'll get you in the hospital same day or next morning. But the images we get two things. We get images of the arteries as if we did a catheterization, so we can see blockage. And then we do a what's called a heart flow. It's a company in California that has this amazing artificial intelligence software that can give us an objective assessment of flow in the artery. And we have some cut points that tell us if it's significant or not, any of the plaques, and that they might need a stent.
Is there a way to lower cholesterol without taking medication?
Yeah, there are a lot of ways.
Will I be on statin forever?
Right now, you'll be on statins forever only because all the research studies we have done are so powerful and show that people who take statins live longer because of the reduction in heart attack or stroke. However, through diet, exercise, you can lower cholesterol. And so some people don't necessarily need statins. One of the first cholesterol medicines ever, I don't want to say invented, but ever used to treat cholesterol is actually a naturally occurring vitamin, niacin. That lowers cholesterol very well. It has lots of side effects, which is why it's not so commonly used. It can cause facial flushing. But yeah, there are ways. And in people who are overweight, you're not overweight, so it would be more difficult. But people who are often overweight, I don't think it's a big surprise that there's an obesity epidemic in this country, and that affects blacks more than whites as well. Diet and exercise can lower their cholesterol. We've had many patients that through diet and exercise are able to come off of diabetes medicines, less blood pressure medicines. And now we have these weight loss drugs, and I'm smiling because I had a patient 2 weeks ago that I discussed one of the weight loss drugs. There's I think 3 or 4 of them now, Ozempic, Wegovy, and when I told him, maybe we can talk about it and consider it, he said, no, just this morning I was listening to the Breakfast Club, and Charlamagne said that when you're on these weight loss drugs, you got diarrhea all the time.
Diarrhea.
And
that's one of the side effects I thought they said sometimes, right? Or no?
That's what I read.
So it could be a side effect. Again, when you read about side effects, often the side effects are in the low single-digit percentages.
Well, I did have a homeboy who was on it. He was an Ozempic gold medalist, and he definitely had diarrhea. He definitely said diarrhea was one of the side effects.
Yeah, and it's possible. Listen, there are definitely...
What do you think about Ozempic? Because, I guess it was supposed to be for diabetes, right?
Correct.
To fight diabetes, but people are using it for weight loss. Is that a healthy thing?
Is that a healthy thing? So it would be healthier if you weren't overweight in the first place.
Correct.
But I don't think we should stigmatize people that are overweight. Some people's metabolism is different. I think I am much more on board now with these medications. At the American Heart Association meetings in November of 2023, there was for the first time a research study that proved that patients who took these weight loss drugs, Ozempic and Wegovy, which are the same drug, actually had a lower risk of heart attacks and death.
Really?
So in certain populations, usually what we do is, we'll try and counsel people. We'll try and work with them, educate them on diet and exercise, and then monitor them. To the extent they can lose weight that way, that would be preferable. But if they can't, there are options. I would prefer a drug to surgery. There are a lot of surgical options to lose weight, but there's lots of side effects, with surgery as well. Patients lose weight. If patients have surgery for weight loss, their weight loss is usually greater than if they take the drugs. If you're taking the injections for weight loss, maximum or the median, I would say, is about 15% of your weight. You'll drop. So if you're 250 pounds, you'll lose maybe 35, 40 pounds.
Last question on this. I know you're not here for that, but what does Ozempic do to make you lose weight? Like, does it, shrink your stomach? Like, what does it do where people lose weight and so fast?
So it affects metabolism and transit time. Okay, so you're transiting your food that you eat much slower through the body, so you feel full more often. So most patients who are on Ozempic or Wegovy or Mounjaro, they don't have an appetite. They don't feel hungry. So I saw someone yesterday, for instance, who had lost 42 pounds, been on it for 6 months, wants to stay on it. But he said he used to eat 3 meals a day and have snacks. He has 1 meal a day now.
Is that healthy?
It depends.
Yeah.
Everything depends. Again, it would be better if we could do all these things naturally. It would be better if we didn't need to use medications. It would be better if people didn't need to see me. But I spent most of my career dealing with the complications of all these problems. And in the last few years, I've really focused on prevention and trying to increase awareness and education. So these conversations are so important. What you all are doing is critically important for all communities to start understanding these things. So, is it healthy? It would be better if we didn't need it, right?
Right.
It's American Heart Month. What should people be doing right now, Dr. Puma?
So it's American Heart Month. I love February because it's Heart Health Month. Every place you turn, every media, no matter how you consume media, you're going to see something about awareness. Get your blood pressure checked. Get blood tests. Check your sugar levels, okay? Go see your doctor. If you don't want to do that or you can't do that, let's start getting healthy. Get off the couch. You don't need to train for the marathon. How about we just get off the couch or, on the way home from work, before you go in, take a brisk walk around the block. In a few weeks, try 2 walks, 2 blocks. Just start getting active. But I think that, February is a great month because it's a great reset month. We think about it, we talk about it, and hopefully it encourages people to take charge of their health. What since I've been on the show last time, what's just amazed me and just blown me away is how many people you've inspired and encouraged to take charge of their health and to just show up. And then the other thing I would do is, if I was a patient, I would put pressure on my doctors. Remember, when you go see the doctor, that doctor works for you. So have a list of questions before you go in. Whether it's things you don't feel well about or things that you're not sure about or side effects of your medicine, have a list of questions. Don't let them leave that room until your questions are answered. Don't let them leave that room until they schedule the test to give you an answer. So really, it's just take charge of your own life.
I have one last question. Signs of a heart attack, right? And I think this is what gives a lot of people anxiety, what Charlamagne was talking. What are the signs of a heart attack, right? Because, if you get a tingling in your left hand, people think heart attack, right? If you get pain on your left side, you think heart attack. If your left arm hurts, heart attack. What are the typical signs of a heart attack?
Yeah, that's actually a great question, and that's the reason why so many people with anxiety come in. So the typical signs of a heart attack, if you're watching George Clooney in ER, let's say, is you get tightness, pressure, like a crushing sensation in your chest. We call it chest pain, but most people say it's not really a pain. Okay, it's a crushing pressure in your chest. Mm-hmm. You get short of breath. You can get diaphoretic, which means cold, clammy, and sweaty. The symptoms often radiate to the left arm associated with numbness, and we're not really sure why that occurs. Mm-hmm. The problem is in women and in diabetics, they get atypical symptoms. What I just described are the typical symptoms. So I'd expect a man like yourself to have those symptoms. But women and diabetics can get atypical symptoms. They can feel fatigued. They can feel a little short of breath. They might feel indigestion-like symptoms. People who have sharp chest pain that increases when they take a deep breath, chest pain that occurs, when they do a particular motion, go to pick up a box or reach for something. That's almost always not from your heart. Mm-hmm. That's almost always musculoskeletal. But let's go back to anxiety. When you're anxious, your heart rate goes up, you hyperventilate, you can get tightness in your chest, it becomes hard to breathe, and you can get numbness in your arm. So it could be exactly the same. The point is, you're not alone out there. You're not alone out there. There's people to help you. Go seek attention. Take charge of your health. Get the answer you need so you can rid yourself of some of this anxiety. That doesn't mean the anxiety will go away. You might still have anxiety and panic attack. Mm-hmm. But at least now you'll have the information to know I'm not having a heart attack.
That's right. And that alone takes away some of the anxiety and the stress.
Yeah.
Give me your information, Dr. Puma. Tell me where to find you.
Well,
we have offices all over New York City, into New Jersey, Monroe, even up in Middletown, New York, sorinmedicalny.com. You can find us there. We have our ambulatory surgical center, and our award-winning Sorin heart scan is based at 120 Wall Street on the corner of South Street, right across from the river near the South Street Seaport. And we accept everyone and anyone, regardless of your insurance status or ability to pay. We're here for the communities that we serve. We have about 25 offices across the New York City area.
All right. Well, thank you, Dr. Puma. We appreciate you for joining us.
Absolutely. Always.
Thank you so much.
Thank you all for having me here. I really appreciate it.
It's The Breakfast Club. Good morning.
Wake that ass up.
Early in the morning.
The Breakfast Club.